Hi, everyone. Good afternoon. I hope everyone is enjoying this fantastic virtual health careers conference. And I'm very pleased and thankful and also congratulate to the organizers of this very useful and a fantastic event, especially during this pandemic time when virtual is kind of the only option we have at the moment. And to be honest, is a fantastic uh, facility to enjoy and learn while sitting at the comfort of in the comfort of our home. So what I'm going to talk about today is a workforce that is only 5% of the NHS, a very small workforce group. As we know, NHS is one of the biggest employers, and 5%, although is very small percentage, still is a substantial numbers. But this 5% workforce creates an impact on 85% of the diagnosis done within the NHS. So before continuing, let me introduce myself. My name is Basit, as is just mentioned. I'm a healthcare scientist, and my specialism is clinical engineering. Currently, I'm doing two jobs, one at NHS England as a healthcare science fellow in workforce development, where I help hospitals in London, Kent, Surrey, and Sussex to grow healthcare science apprenticeships. And my second role is at Barts Health NHS Trust, where the job is more operational, where I design, execute, and run clinical engineering apprenticeships. I'm also a clinical entrepreneur on NHS England's clinical entrepreneur program. So before proceeding, just a couple of more points. One, as you can see on the screen, my Twitter hashtag, if you want to reach out in future. And more importantly, there is a website mentioned as skillsforhcs.com with a link as info for students. So to make accessible and as much as possible user-friendly, I have uploaded all the content that I'm going to share today in this presentation on this website, and you can so that you can go later and access whenever you or your friends and family colleagues want to know more about healthcare science and apprenticeships. Right. So hopefully everyone is able to see the screen, the slides on it. I'm on the second slide. So today, what I am going to do is to try to answer these questions which are on the screen. So first one is, what is healthcare science? And what are the different entry routes and career progression to become a healthcare scientist? Following on, I will be talking on what is an apprenticeship, and in particularly healthcare science apprenticeships. Then who fits the bill and what are the challenges in healthcare science profession? And finally, what qualifications or criteria are needed and how and when to apply? And hopefully we will have time and I will share a couple of tips and tricks to in order to uh, apply for the jobs that if you may find healthcare science as an interesting career. And we will take the question and answer towards the end. You can write down any questions that you may come across. I will be able to see them in the chat, and then I will try to answer as many as possible. So let's move on. What is healthcare science? Healthcare science is a professional identity in the UK, just like doctors and nurses and allied health professions. And this healthcare science, the umbrella covers more than 50 specialisms, which are divided into four themes. And as I previously mentioned, the workforce is 5% of the total NHS workforce, which is around 55,000 people. And there is an impact on 85% of the diagnosis. So four themes uh, are: number one is the life sciences. This covers areas like pathology, biochemistry, hematology. The next theme of the healthcare science is physiological sciences that covers audiology, cardiac physiology, critical care, healthcare science, ophthalmology as well. And then the fourth theme is physical sciences, that covers specialisms including nuclear medicine, radiotherapy, physics, clinical engineering, rehabilitation engineering, and many more, which I'll show you in the next slide. And finally, the fourth theme of healthcare science is bioinformatics, that covers areas like genomics and health informatics. So on this slide, you can see all specialisms, and this is not a static information. The specialisms are, to be honest, growing continuously. And you can see the life sciences, physical sciences, physiological and bioinformatics specialisms within the umbrella of healthcare science. Now, let's move on to the next question, that what are the different entry routes and career progression to become a healthcare scientist? There are yeah, these healthcare science entry routes are range from level 2 or GCSE equivalent all the way to doctoral level, as you can see on the screen. So, and these equivalent educational equivalents have number of entry routes, including the formal education and training, other training programs, and apprenticeship routes. Let's look into a bit more in detail. So level 2 or GCSE equivalent route is only apprenticeship route at the moment. I'll talk later today on apprenticeships. Level 4, which is a post A levels in apprenticeship world, the equivalence of level A levels is level 3. So in healthcare science, we have level 4 only. Means that there is no level 3 apprenticeship available in healthcare science. So again, as you can see, apprenticeship route is only available, is the only route available under level 4. Following is the BSc level. So there are two routes to in this at this level. The one is called practitioner training program, and the other one is apprenticeship route level 6. Then master's level, there is a program called Scientist Training Program or STP, and there is apprenticeship route at level 7. And finally, doctoral level is the Higher Science Specialist Scientist Training Program or HSST. The website I mentioned in the beginning, you will be able to see a bit more information on these routes on PTP, STP, and HSST, and the links to the National School of Healthcare Science with further details. But at this point, I'll just highlight a couple of points. Number one is that PTP program, which is a BSc equivalent, this is a self-funded route where trainees or students pay their fee to the university. Um, and whereas the difference between PTP and STP is that the STP applicants or STP trainees, they are employees of an NHS trust, and their fee is paid by HE or the trust they are working in, and also they get salary. So PTP, there is no salary attached. They just study in a university, but also they get a number of weeks of workplace training in a hospital. Whereas STP is, again, they work in a hospital, but their fee is paid by the Health Education England, and they get a salary as well, a decent salary. And the HSST is a doctoral level, as I mentioned, and this is predominantly the current staff at a senior level, because this lead to consultant level healthcare scientist. Let's move on to the next point or question. What is an apprenticeship, and in particular healthcare science apprenticeships? So apprenticeship is a work-based training program open to people of all age, minimum 16. Uh, then apprentices complete their apprenticeship program within 1 to 4 years. Only a few apprenticeship programs are 5 years long, but generally it is between 1 and 2. There is no apprenticeship program less than 1 year or less than 365 days. The reason behind is that the endpoint assessment of an apprenticeship can only be done on 366th day. So there is no apprenticeship program less than 1 year. Then the apprentices learn job specific skills, working hands on alongside the experience, which is the most important bit of being an apprentice, because you are learning from experienced staff, world class experienced staff in an NHS hospital. um, all because apprenticeship is a job, so it comes with a salary, and apprentices study in a college or a university or a training provider, and there is a protected time, which means that an employer where you are working as an apprentice, they cannot ask you to just go home, study or complete your assignments and study during the weekends or during your own time. But whereas the study time is a protected time in an apprenticeship, and this is 20%, uh, which is called off the job training. So 20% means 1 day in a 5 day working week. Uh, and which means that an apprentice gets this time to either study, do their assignments, go to college, or shadow an experienced engineer or healthcare scientist or their experienced staff member to learn the new skills. And finally, the apprentices gain nationally recognized qualification, which means that if you, for example, you are an apprentice of King's College Hospital, when you finish, you get the apprenticeship certificate, you can show that to your next employer, maybe somewhere in anywhere in the country, and that is a nationally recognized qualification. Um, Here below, you can see the equation which shows that workplace training is approximately 4 days you work, you learn, and academic program is approximately 1 day, which is 20%, and that leads to if 1 to 4 years of apprenticeship in healthcare science specialism. And this specialism could be any specialism, and the one I mentioned in the previous slides, more than 50 in the list. And here 2 or 3 points I would like to highlight here: that equal opportunities for existing employees as well as new starters. So if you are currently an NHS employee and you want to start an apprenticeship, means you want to study, learn new skills, or even want to change the career, then you are allowed to do that. And no age limit means that anyone can change their career if they wish to do so, and there is no limit on becoming an apprentice. Previously it was, but the reforms happened in back in 2017 18. There is no limit on that. And as I mentioned, the career change is absolutely welcome. We have apprentices currently, even 54 years old, and which is they find the opportunity amazing, and they wanted to become, in my case, become a clinical engineer, and they are becoming that. Now, why do an apprenticeship? So as previously mentioned, gain nationally recognized qualification, then work, learn and earn at the same time. Like there's no requirement, there's no way of elaborating this more, that apprenticeship is a great route to enter, because apprentices learn and earn at the same time, which means that we as employers send you to a university or a training provider or college, uh, and not only pay the fee but also pay you to go there and study, meet your personal development needs, progress your career and academic plans, learn in a flexible way that fits around your needs. This means that each individual apprentice get their own training plan, which they discuss with their line manager and also assessors and the training provider, the teachers. So they have their own plan, and they go along that plan. Is not about what the others are doing, is about in an individual's need. And finally, develop a wide range of skills required in the health sector now and in the future, which is no brainer. Now let's focus on healthcare science apprenticeships. So in healthcare science, we have four standards available at the moment. So these standard mean that this a standard, an apprenticeship standard, has an equivalence to a journal education qualification, which, for example, level 2 means a GCSE level, level 3 means A levels, 4 is called higher apprenticeship, level 5 is equivalent to a foundation degree, level 6 is a degree level equivalent, and level 7 is a master's degree, level 8 would be a PhD. I believe there is no level 8 apprenticeship standard available at the moment, but these standards are continuously being developed by the employers and getting recognized and stamped by the government, which is the ESFA, Education Skills Funding Agency. So in healthcare science, we have a nice complete spectrum of healthcare science standards, which is level 2, called healthcare science assistant. Level 4 is associate. Level 6 is a practitioner level, and the scientist, clinical scientist, is at level 7, which has recently been approved, and very soon we will be having universities ready to deliver this program, so that employers, means NHS trusts predominantly, they will be able to recruit apprentices, either from their current staff or new fresh graduates, to be on a master's level apprenticeship, so they study and um, mm, learn and earn at the same time. So a bit more detail on these standards. Healthcare science assistant. This information, which is just in front of you, it shows few. It shows, number one, the agenda for change band, which means the salary attached to each job, and this is an approximate, which means that every trust may have slightly different based on their own rules and regulations. So these bands, which is band 2 of at healthcare science assistant, band 3-ish at associate level, and 4 is practitioner level. This is not a definite band, but is an approximate band. You can, when you apply for a particular job, you will be able to see which band or which salary, what salary is attached to that particular job, which, I mean apprenticeship job. The duration of assistant level is between 12 to 18 months. Level 4 is, which is healthcare science associate, is typically a 24 months program, and level 6 is a degree program, which is minimum 36 months, which is 3 years, or up to 5 years. Predominantly, these are 4-year programs. Only a couple of universities deliver specialized uh, programs in 5 years. And alongside each level, you can see the types of jobs each apprentice would be doing while being on this healthcare science apprenticeship. Now let's see who fits the bill and what are the challenges in healthcare science profession. So we are looking for apprentices who are keenly interested in the welfare of others and have caring attitude to other people, which I think there's no need to elaborate on this, as anyone working in an NHS environment, their ultimate aim is patient care, and patient care can't be delivered if someone don't have a caring attitude to other people. Are good listeners, honest, friendly, and have professional attitude to work. So, as previously mentioned, and this is very important point, that an apprentice is an employee of an NHS trust or any employer, which means that they they get salary, but they also adhere to all the other rules and regulations, just like any other employee of that organization. They also get all the benefits of being an employee. For example, in the NHS, all the discounts attached to NHS workers, they get that. And also, because and as an apprentice, you are not only employee of NHS, but you are also a student of a university or a college, which means that you get a student card and student discounts attached to that. And on the other side, um, you, an apprentice behaves and acts and performs everything that other employees are working, whether they are in their early careers or they are in the organization for 30 years. And then uh, the apprentices are or prospective apprentices are excited about learning and to improve and innovate for patient care and safety. Our team players accept personal responsibility and strive to deliver excellent results, treat everyone with respect and dignity. And finally, this is not an exhaustive list, of course, but just the top level bits that are important, which when you apply for and get interview, for example, the interview managers would be looking these characteristics and values. Are problem solvers and thrilled to use technical skills for healthcare. So as previously highlighted, the healthcare science is it covers 54 specialisms of scientific and technical nature, and range from bioinformatics, people working on the computer science, to rehabilitation engineering, to clinical engineering, all the way to people working in the lab sciences or more patient facing roles as audiologist or cardiac physiologist. So by core, the healthcare scientists are problem solvers, and they use technology and equipment all every day, all the time. Now challenges, because working in a hospital has challenges, but working as a healthcare scientist bring some more challenges. For example, some exposure to body fluids is possible. However, the post holder, they get all the training to the higher standards of hygiene management. The role involves meeting and working with people from all backgrounds, which is the beauty of working in an NHS hospital. We come across all backgrounds, huge variety of nations working in the NHS, which is a great player, but it is important to know beforehand. And sometimes there will be a need to assist with patients or relatives who that are distressed. Uh, Apprentices or workers, healthcare scientists, they wear uniform on duty, work in a busy clinical environment, and also um, an NHS trust means that there are more than one hospital attached to it. So when you apply for a particular job, it is important to consider and perhaps ask this question, which other sides of this trust are, so that you are aware that the you may need to go to other sides of the same hospital, sorry, same NHS trust. What qualifications or criteria are needed, and how and when to apply for a healthcare science apprenticeship? Right, so here you can see a few bullet points. But before going into that detail, I'll re-emphasize the fact that an apprenticeship is a job, which means a job description is attached to it, and a job is advertised on various websites by the employer, and uh, prospective apprentices, they apply for that job, they get interviewed and recruited as an employee of an NHS trust. So this means that when creating a job, in a healthcare science apprenticeship job, the employer has their own set criteria. We know now that there are a number of healthcare science standards available from level 2 all the way to degree or master's level, which means that anyone can apply based on their previous knowledge and experience and aspirations. Uh, so they can apply, and while applying, they need to see what criteria an employer has set in the job description. So that is one bit of limitation or point to consider is the employer criteria. The other one is the HEI criteria. HEI is Higher Education Institute or university. So as we know, going into particular specialisms, every university has their own criteria. For example, some specialisms may need you to have maths as a subject, or physics or biology as a subject, or information technology as a subject at A levels or level 3 education. So depending on that um, criteria of HEI, the employer, while creating the job description, they mention that the applicants must be having these essential criteria to be justified or fulfilled, and these are some desired criteria as well, which adds to the quality of application, but that is desired. But do look at the essential criteria. Functional skill, that is a level 2 qualification in English and maths. It is important for any any apprenticeship in England to have these functional skills done. If you have a GCSE passed at minimum C levels, C grades, you do not require a further functional skills qualification. But if you either don't have at C levels, or you perhaps have done your education outside the UK, then and you do not have the certificate to provide the equivalence, then a functional skill qualification is also required. But this is, and again, this depends on the employer and the training provider to set the criteria whether you must have that before starting the apprenticeship, or you can study that alongside studying the apprenticeship program. In any case, there is no the government funds these functional skill qualifications, so there is no charge to an apprentice to do this qualification. It's just a matter of having some extra load of studying while doing the apprenticeship, if the criteria is to just start the apprenticeship and study alongside. Prior learning, I mentioned previously that anyone can start an apprenticeship at any time of their working career, at any age. However, uh, the one criteria of one rule of apprenticeship is that you can only go higher, both in terms of qualification as knowledge and experience, which means that if someone, just an example, if someone, let's say, have a degree in law, a law degree, and they want to start a clinical engineering or a healthcare science degree program, they can easily start straightforward, because their previous knowledge as having a law degree, and their experience, they may be working in law firm for a few years. So though that experience and knowledge is completely different from the experience and knowledge they will gain at while doing a healthcare science apprenticeship. There is no problem at all. However, if someone, let's say, has a degree in electronics engineering, and they want to start a clinical engineering healthcare science apprenticeship, so in that respect, the HEI, the university attached, they would look into the prior learning of that candidate, and if it completely overlaps, unfortunately, that person cannot start a level 6 healthcare science apprenticeship. They may apply and be successful at a higher level, which is the master's level, level 6 apprenticeship of healthcare science, but they cannot start at level level 6. And it depends on the availability, what is available. So if, unfortunately, by if a level 7 degree is if level 7 apprenticeship is not available, then unfortunately that person cannot start a healthcare science qualification, because their previous qualification is similar or same as the new one. However, if the HEI identified that their previous qualification has some bits of knowledge which is same as the new qualification, but there is a substantial amount which is different from their previous qualification, then yes, they can start, and they in fact they will be able to finish earlier, because the education provider will identify and acknowledge the prior learning. Um, Now, the FE College and training providers. So these 2 points, the last 2 points, FE College and the university, this relates to when you can apply for apprenticeship. So for level 6 and level 7, which is masters and degree level apprenticeships, these are delivered by universities, and as we know that most majority of the university programs start in September. So there is you will see most of the mm, apprenticeships, healthcare science apprenticeships at these two levels, means 6 and 7. These opportunities come only in around June, July, or maximum August time, because the September is the starting of these programs. However, the level 2 and level 4 healthcare science apprenticeships are delivered by either FE colleges. FE is further education, so FE colleges and private training providers. So employers get quite a lot of flexibility in delivering these apprenticeships. Generally, they run training providers run cohorts 2 to 3 times a year, which means whenever there is a vacancy in a department, an employer uh, can start an apprenticeship program within their department. They approach to training providers, and whenever the new cohort of trainees is going to start, they enroll apprentices, which means that if and in general, historically, these level 2 and 4 apprentices predominantly are the opportunities come in September, and well, it starts in September and December, which means that job vacancies will appear on job websites around 2 to 3 months prior to that time. Let's see a bit more on the jobs, because I believe there would be a lot of questions on the jobs and where to find those. So here you can see resources section. So if you want to search for what vacancies are available, what jobs, what healthcare science apprenticeship jobs are available. So number one is you can go to Twitter, search for hashtag HCS app, which means HCS apprenticeship jobs, HCS app jobs, or to search for any or all kind of jobs on in the NHS. The best website is jobs.nhs.uk. So you can find apprenticeships as well over there, as because apprenticeship is a job. Then the National Apprenticeship Service is a fantastic platform to have that shows all types of apprenticeships, and which means that, well, apprenticeship, there are hundreds of different types of apprenticeships, from law degree to leadership and management to um, working as a becoming a dentist or a nurse, or even working in Amazon as their engineers. So hundreds of apprenticeships are available at the moment in the UK. And predominantly, I'm talking about English apprenticeships, the apprenticeships available in England. So this website, findapprenticeship.service.gov.uk, is fantastic resource to search jobs near your postcode, for example. And finally, the website I previously mentioned, skills4hcs.com, it has a page which is /jobs. This gets populated with any healthcare science apprenticeship job appearing on in any hospital in the country. So this is another resource where you can keep an eye on to find healthcare science apprenticeships. So I think we are well in time. Before question answer, just the last bit I would highlight, as I previously promised, a tip to apply and have a successful move to an interview. When you apply for a job on NHS website, we create jobs.nhs.uk, or any other NHS jobs. Um, Either it is shared by the trust on their own website. There are sections of your personal information, your qualification, previous experience, but towards the end there is a free text available that has where you can write anything. Very often we see that is not fully utilized. And what I want to tell you here is that section is one of the most important sections and must be utilized fully, um, where you can write whatever you want to. What the tip here is to look into the job description and look for what the essential criteria the employer is looking for, or the desired criteria, and try to link with your previous experience or knowledge, and mention it clearly as much as possible in that section, as concise and brief. We totally appreciate that at level 2 and level 4, the apprentices are or applicants are predominantly school leavers, and they may not have any experience before, or may have experience working in just a part-time job at McDonald's or somewhere, but never been to a hospital environment before. We as the managers, we totally appreciate this. So that opportunity is an important bit, because where you can link with your previous experience uh, in your home, helping your parents, or helping in the school doing a school project, how that project is linked to, for example, team working requirement of the application that you are filling in. So just a little bit of food for thought to try to link honestly, of course, as much as possible, and sell yourself, because applications that come for apprenticeship jobs are many times more than the jobs. I can give you an example within my Bart's hat on. When I have 4 jobs, apprenticeship jobs available, I receive around 90 to 100 applications minimum for 4 jobs. So it is a very competitive scenario. But once you are in the apprenticeship program, you learn at the same time, and a very promising career is ahead of you. So let's look at the questions, and I'll try to answer. Um, right. One question is, what is clinical engineering? So clinical engineers work on medical devices. So could range from a simple thermometer or a patient monitor to ventilators, as we know in nowadays being heavily used for COVID patients, to MRI scanners. So in clinical engineers maintain, they inspect, they repair medical devices in a hospital environment. They also link link with research departments. They help in development of new devices, and also they work in the safety aspects of medical devices. So the complete life cycle of medical equipment in a hospital is managed by a clinical engineering department. Someone says, I'm interested in finding a clinical coding apprenticeship in Birmingham. So, yeah, you are most welcome. You can go to NHS Jobs website, put your postcode, and you can mention how far you like 5, 10 miles, 15 miles from your home area, and look for clinical coding. Few um, keywords like clinical coding, also apprenticeship, if word, and you can create a search, save it, and whenever there is similar job available, they will send an automatic email to you. Question is, how do you apply for an apprenticeship? I hope I mentioned this on in the slides. Mm, is through the jobs which are advertised on NHS Jobs website, the National Apprenticeship website, or the trust. So if you want to work within near your home area, then look for the jobs on your local trust website. Are there any apprenticeships in neuroscience? Level 6 apprenticeships are neurophysiology. These are available, which is the PTP equivalent, level 6. And I'm pretty sure the other level 2 and 4 may be available in rest of the country. I'm not aware within my trust at the moment, but you can, as mentioned, just search in the link. Uh, However, I can assure you that yes, curriculum is available and training providers do deliver. Any apprenticeship for medicine? Not at the moment. There are dental nursing or and nurse apprenticeships at various levels are available, but not in medicine. Do you have any other tips on applications and interviews for STP? Um, for scientist training program is extremely competitive program. What I would say is, just as I previously mentioned, on looking into the job description and this person specific requirements, and do mention in the in the free text area. Also, one tip I would say is that reach out to the local manager in a trust, or where you are applying, or in a trust which is near to your home or study area, wherever you're living. Try to have some work experience. That will help you a lot. Work experience in the department that you are interested in, just for even for exploratory purpose. You may come across that that is the specialism you are not interested, and you may go for another work experience for another department. But for the application and interviews, work experience helps a lot. If I'm an apprentice, for example, in an office role, 9 to 5, would I be able to work part time on weekends to get more income, or would this be not allowed? Uh, I don't think there is any restriction on that, as long as you have you are working within the national allowed working hours, but you must inform your employer as an apprentice that you are working and how many hours you in total per week you are working, because they are what is most important to them is your health and well-being. So that is important. And being an apprentice, because you are also an employee, so you would be getting salary from the apprentice post as well. Are the qualifications only recognized nationally, or can travel with qualifications? So the level 2 and 4, they are predominantly nationally approved qualifications. Um, the level 7, for example, the clinical scientist STP program, uh, I believe that is it, because this is delivered by by a university, and also level 6 is a university program, and these are the curriculum is same as the PTP program and the other the international students that come and study. So I would these are, to my knowledge, are nationally recognized, because because it's approved by the National School of Healthcare Science as well as the university. But is better you reach out to the university who is delivering that qualification you are interested in, and do get some more clarification, receive it. Do you know if there are any apprenticeships or simulation technician role I come across in the past? Yes, there are simulation technician apprenticeships are available. Uh, in the past, yes, it depends when there is a need, the employer advertise it. But yes, I have seen in the past. Is clinical engineering and biomedical engineering is same? So clinical engineering is a there is no hard and fast definition. A clinical various departments within the UK and across the world, they name differently. The same person may be called as clinical engineer. Somewhere they called EBME, which is electrobiomedical engineering uh, engineers, or they sometimes they call clinical technologists. They also called clinical technicians, biomedical engineers. So there are a number of names called. However, in terms in educational route, a clinical engineering is kind of a subset of broader academic biomedical engineering. Biomedical engineering subjects, when you look at the university profile, you will find they study a variety of other things, for example tissue engineering, and so on. But clinical engineers are mainly focused on the medical device itself and its engineering and electronics.